Hi, I'm Dr. Mike from the Springfield Wellness Center, and the topic we're going to cover today is spina bifida. So spina bifida is basically a non-closure of the posterior portion of a vertebrae. And what does that mean to the average individual? Most cases, and most commonly, it's pretty asymptomatic, aclinical. What it means is that when we look at the spine, backside of the vertebrae, we have what we call the spinous process, with this big bony outpouching. It's what we can feel when we run our fingers along the backside of the spine. What happens with spina bifida, most commonly occurring at the very, very top of the spine, as opposed to getting that connection between the two, we actually don't have that full connection. So as opposed to coming and forming a full bony circle, like we see in most of the vertebrae, we don't actually have that connection. And so what we end up getting is either a gap between the two, so the two pieces, as opposed to forming like this, there'll either be a gap between the two, or sometimes even to like a crossing kind of position. Like I said, most commonly, we see it at C1, so the very, very top of the spine, as well as the very, very bottom of the spine. Spina bifida occulta is the most common version of it. It's still a very uncommon thing to see, but of the different varieties, it is the most common version of it. Like I said, basically aclinical. So we don't really typically see any major symptoms that come from that. During the development process as a fetus, the vertebrae are supposed to fuse, what we call our neural tube. When that doesn't properly fuse, that's when we get to that point of that spina bifida. In its worst case, we can actually see some neurologic type issues. So we can see an outpouching of a spinal cord or spinal nerves. That can be pretty symptomatic for in certain cases. Sometimes we can correct it with surgery, sometimes not. But what we typically see is the spina bifida occulta. Usually comes in as kind of an incidentally noted thing on an x-ray. They go in to the ER after a car accident, they get a cervical x-ray. Oh, and by the way, you have this issue up in your neck. What it means for us in terms of care, somebody can come in with a complaint of headaches or neck pain. Incidentally noted, and they noted on their paperwork or during the discussion, we figure out that they have the spina bifida occulta. Still can treat those patients 100% of the time. We just don't work specifically in that area. So if we have that non-union or that non-closure at say C1, we just wouldn't work on the C1 vertebrae, just simply because a little bit higher risk for some neurologic stuff, just because we don't have that full bony enclosure. Like I said, typically incidentally noted, the worst off cases typically aren't coming into our office because a lot of neurologic stuff that's more of a surgical realm of things. But in the asymptomatic aclinical cases, incidentally noted, doesn't typically cause any problems. We see that pretty infrequently, about maybe 5% of the population will have these. So they come in just simply with a complaint, something that we find during the course of the exam or consult, nothing that says that we can't help or work with those individuals. Hopefully you found this informative and helpful. If you did, like it, share it with your friends.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.